I'm Sofia Mendes. I'm a compliance consultant with Buxton Coates Solicitors. CQC inspections don't have to be stressful. In this video, I want to talk you through a real CQC inspection that went exactly to plan. Not because of last-minute panic, but because of the preparation done beforehand. And preparation involved the practice principal, the practice manager, and the head nurse. The goal wasn't to prepare for CQC in the traditional sense, but to make sure the practice was already working in a way that CQC would expect to see. Before the inspection ever took place, we started by reviewing all of the practice policies. We checked that they were correct, in date, and aligned with current guidance. Importantly, we also made sure staff knew where those policies were and could access them easily. We then reviewed all audits and risk assessments. During this process, we identified a few gaps. Some audits highlighted issues but didn't include a clear action plan or evidence that the findings had been addressed. Those action plans were then put into place, responsibilities were assigned, and outcomes were documented. We also met with the whole team. This wasn't about creating fear around the inspection. It was about explaining what to expect, how CQC inspections actually run, and how each team member plays a role. One of the more challenging areas was CPD. While staff records were complete, some team members had missed a few required courses. We addressed this early, organised the necessary training, gathered all certificates, and ensured CPD evidence was saved both in individual staff files and in a central folder ready for inspection. To make inspection itself easier, we also created a dedicated CQC folder containing everything CQC had requested in advance. This meant nothing needed to be searched for on the day. When inspection day arrived, the CQC inspector attended alongside a clinical advisor who was a registered dental professional. They were welcomed into the practice, signed the visitor's book, and given a brief walkthrough. A quiet space had been prepared so he could introduce the practice, talk through its ethos, and explain the owner's vision. This set a calm, professional tone for the day. The inspection then split in two parallel streams. The practice principal accompanied the clinical advisor, who reviewed clinical records across different clinicians to assess consistency and quality. They also checked clinical drawers to ensure materials were in date and that there was a system for managing expired stock. The team demonstrated a clear process for reprocessing sterilized instruments that had been stored long-term. In the decontamination room, a nurse was asked to explain the full decontamination flow process from start to finish. This includes handling dirty instruments, hand hygiene, PPE use, manual cleaning at the correct temperature, ultrasonic cleaning, inspection, sterilization, post-cycle inspection, and correct pouching, dating, and signing. The logbooks for decontamination, ultrasonic baths, and autoclaves were all complete and up to date. Needle stick injury posters were clearly displayed, accident records were properly documented, and emergency drugs, oxygen, and the defibrillator were all checked regularly and recorded correctly. Whilst this was happening, I stayed with the CQC inspector, who had a structured list of documents and questions. Because of the preparation done beforehand, everything was easily accessible. She reviewed maintenance records in detail, focusing not just on whether checks had been done, but whether they were completed on time and whether issues had been followed through. There was particular focus on the fire risk assessment and Legionella risk assessment. She asked what actions had been recommended by external engineers, whether those actions had been completed, and where the evidence was recorded. Having clear action plans and follow-up documentation made this straightforward. She also reviewed staff records and CPD in detail, which again reflected the work done ahead of time. Towards the end of the inspection, the inspector carried out another walkthrough to confirm that what she's seen on paper matched reality. She spoke individually with team members, including associates, hygienists, nurses, and reception staff, asking whether they felt safe at work, respected, and listened to. Patient experience was also explored. Written feedback that had been previously sent directly by the patients to CQC was reviewed and shared with the practice, and the inspector spoke directly with patients in the waiting area. Patients confirmed that treatment was explained clearly, consent was obtained properly, options were discussed, and nothing proceeded unless they fully understood. This inspection went well, not because of luck or last-minute preparation, but because compliance was embedded into how the practice worked every day. When systems, documentations, and people are aligned, inspections feel calm and predictable.